disturbances of responses to sensory stimuli. This slide reads, the child's behavior may range from being hyperactive to being unresponsive to people and objects in his or her environment and can alternate between these two states over periods ranging from hours to months. Disturbances may be apparent in auditory, visual, olfactory, gustatory, tactile, and kinesthetic responses. The child may respond to stimulation inappropriately and in repetitive or unmeaningful ways. Many individuals with autism have difficulty learning to self-regulate their energy and emotions. As these children grow up, they learn to be still for growing periods of time, but often at a rate much less than their same-age peers. We may see both ends of an extreme with children on the autism spectrum. They may be very unfocused and flit from one object or activity to another, or they may sit transfixed through activities. Activity level may not be comparable to those of their same-age peers. Individuals with autism spectrum disorder also process sensory input differently than typically developing children. While each child has a different sensory profile, there seems to be some consistency, with auditory differences appearing to be the most frequent, while olfactory differences seem to be the least frequent. Even within a sense, a child may be oversensitive or undersensitive to different aspects. Let's read the definition of sensory integration. Sensory integration is the process by which the nervous system receives, organizes, filters, and integrates sensory information in order to make an appropriate response. This process works for the individual as a means for environmental protection and survival, while allowing for environmental interaction and learning. You might want to take just a minute to review Resource 7, which is entitled, What is Sensory Integration? So what are your five senses? Of course you know they include vision, hearing, taste, touch, and smell. The primary job of our five senses is to give us important information that will protect us and ultimately contribute to our survival. And perhaps the secondary purpose is to help us learn. So let's talk about learning. Children begin life in a confusing world full of undifferentiated sensation. They very soon start to make sense of this input. Their ears begin to differentiate the sounds of voices and the sounds of their mothers and fathers. They listen to the voices and develop comprehension of language. Their eyes begin to focus and they start understanding visual input. A regular schedule of being held, moved, changed, and fed gives meaning to the tactile and kinesthetic feelings of their experience. Children begin to develop a sense of the reality their environment provides through interpreting this sensory input. They respond and interact with that environment and try to control their responses. Children who are processing sensory input differently may have a very different experience. If sounds are too painful, some individuals learn to tune out their hearing to protect themselves. As a consequence, they miss many opportunities to learn communication. Children who are tactily sensitive may scream when they're picked up. If parents decrease their physical contact with the child, it also decreases their opportunities to gain interactional skills. With each sense that is functioning differently, children lose some of the typical learning about their environment. Babies continue to grow and think, but they may be forming an unusual picture of their environment and missing chances to become more functional in their life skills. Here are some possible signs of sensory motor problems. If you happen to see a child spinning, possibly head banging, having meltdowns or outbursts, disliking change, hand flapping, clumsiness, floppy muscle tone, All of these can be possible signs of sensory motor problems. They're not necessarily signs that are indicative of autism. They just are signs of sensory motor processing problems. Possible signs of motor problems include raised, high guard shoulders, walking on tiptoes, poor gross motor skills, poor fine motor skills, and possibly poor handwriting. Have you ever thought about what the inhibitors to learning actually include? There are 3 basic inhibitors that will prevent you from learning. One of them is interest. Why are you joining us today? Is it because your administrator told you to? Is it because you didn't have anything else to do? What if I began talking about the migrating habits of the yellow-speckled, fan-tailed, orange-beaked hawk? How interested would you be? Some of you might be, but most of you, I doubt, would be very interested. Interest is a big factor in wanting to learn. So, what do you think the second one is? Comfort. Physical comfort is very important to learning. If you're not physically comfortable, you'll be distracted and not able to learn as well as when you are physically comfortable. Remember, persons with autism have sensory distractors that make their physical comfort very difficult. Look at behavior through your sensory eyes and see if some sensory accommodations might be helpful. The third inhibitor to learning is fear. If a person is fearful, nervous, or anxious, learning is extremely difficult. Persons with autism have a heightened anxiety and don't always understand how to cope with unexpected circumstances. Keep in mind that anxiety can create huge obstacles to learning. Think of something you find anxiety-producing. How do you feel when that circumstance or situation is present? For example, are you particularly fond of snakes, or mice, or spiders, or small tight spaces, or tall, high places? What if there were several loose snakes, or spiders, or mice in the room with you right now? How distracted would you be? Imagine what life would be like if you were worried about snakes, spiders, mice all the time. Having a certain amount of anxiety present all the time is what it's like experiencing autism. It makes coping with life and its unexpected circumstances very difficult. At about 2 weeks gestation, the central nervous system has begun to organize and integrate itself with the beginnings of the motor system. As you can see from this slide, the sensory cortex and the motor cortex are located right next to each other. The 2 speech areas of the brain, however, are not close to each other. They are, in fact, completely separated. Broca's area is where articulation and the ability to speak or form words is located. Wernicke's area is where comprehension or understanding, receptive language is located. This is why some individuals can articulate quite clearly but cannot process information as quickly as we might expect. On the other hand, processing information might not be a problem, but articulating what is desired might be the obstacle. Generally speaking, processing problems are common among persons with autism. There are several sensory motor systems. You've got your vestibular system, which is what modulates equilibrium and balance. You have your proprioceptive system, which is about pressure to muscles and joints, as well as tendons. And then you have your tactile system, which includes two systems of discrimination. Where is the touch versus defensiveness? How painful or pleasant is the touch? You also have your auditory system, which also includes discrimination. Where's the sound coming from? And defensiveness. Is the sound painful or pleasant? This is a visual way to show you what auditory processing problems might look like, i.e. sound like. If I were to say, if I ud f v ter ing me, and asked you to write it down, you'd be looking at me like I'm looking at you. What are you talking about? Sometimes in persons with autism, their processing ability leaves out important syllables. Some syllables are muffled or missed entirely. Without the added syllables to give you more information, you don't have any way of knowing or recognizing what this sentence is really saying. If you aren't being resistant or uncooperative, you aren't being resistant or cooperative, you simply don't understand because you don't have all the information. Similarly, some persons with autism don't have all the information needed, so they look uncooperative or resistant, but they really are confused and just don't have the proper amount that they need. If I don't talk loud enough, you'll have trouble hearing me. Vision is another area of sensory motor integration, and peripheral or side vision is the first to develop in infants, followed by top vision, and finally front or focal vision. Though we like to see front and focal vision, our child with autism may not have muscle development to that point, and front focal vision is sometimes very painful to endure. So when you're looking for attention, it doesn't need to always be through eye contact. It can be through some other point of communication other than direct focal vision looking at you. This is something to consider when you're working with your youngsters experiencing autism. Just as with sensitivity to auditory signals, those with autism may demonstrate hypo or hyperacuity to visual stimulation, or they may have difficulty distinguishing salient elements in a visual representation. Certainly, reading problems can result from visual acuity and processing problems. Here's an example of perceptual visual problems. Now, fortunately, most persons with autism spectrum disorder don't experience all of these at once. But this is an example of reversals, mirroring, closure issues, and decoding problems. See if you can figure it out. Did you get it? Doing board work is difficult when your eyes see like this. If your eyes saw like that, How motivated would you be to do board work? It may not be the subject that the student is avoiding. It may be his visual perception that makes doing board work difficult. This slide is about possible signs of sensory motor problems. You have this slide as your resource 10 in your materials, and I'd like for you to just take a couple of seconds to look over all the different symptoms of where problems might be coming from. And as you look through this, again, I want to remind you, just because a person has many sensory motor problems doesn't automatically conclude that they're experiencing autism. You can have a whole boatload of sensory motor integration problems and not one tiny little paintbrush stroke of autism. On the other hand, it is very typical for a youngster with autism to have some kind of sensory motor issues. As you're reading through these signs of sensory motor problems, do you have any children that come to mind? What kinds of influence do sensory motor problems have on the students that you work with? When we get together for the working with autistic students in the schools, there'll be a couple of face-to-face days, and we're going to review some of the sensory motor information in those face-to-face days. Resource 11 is this slide and a list of possible signs of problems that might occur in specific sensory motor areas. This can help you to determine what kinds of interventions you might want to try. So again, take a few minutes to review this resource. In addition, you have a couple of other resources. Resource 12, alerting sensory activities for the classroom if you want to alert your youngsters, versus Resource 13, which is a list of calming activities that you might want to use in your classroom. Resources 12 and 13 have sample alerting and calming activities that can be used in a classroom for any children. They are grouped by target areas. You will notice that some activities fall in more than one area. So take a few minutes to look at Resource 12 and 13 as well. Our final slide, which is also included in your resource, would be Resource 14, is a list of precautions that alert you to undesired responses to an intervention. Should any of these occur, immediately stop what you're doing. While most of the classroom activities from resources 11 and 12 are safe and will probably not elicit any problem reaction, it is good to know what might be signaling a problem. None of these classroom activities require a prescription from an occupational therapist. However, if you are going to work one-on-one with a child, it's always best practice to have an occupational therapist demonstrate the activity first, or to check in with an occupational therapist to see if the intervention is appropriate for the child. These alerting and calming classroom activities are generally designed, and most children, whether or not in need of specific or more intense sensory intervention, will respond to them.